Okay, now we begin the labor and delivery portion of this course. And before we do that, I have some slides here. This just kind of reviews what we talked about in the last lecture. And I won't go over them, but you can look at them if you want in the PowerPoints. But I did want to go over this because I didn't get a chance to do it. So when there is prom or pre-prom or PPROM, there's two tests that we can do to verify if it is truly amniotic fluid or if it's just regular vaginal secretions or urine. So we can do first what's called a nitrazine test, and it's just a pH test. So I'm sure lots of you have seen it in the hospitals or in clinics where you work, but the main how this works is it's pH paper, and it measures the pH, acidity or alkalinity of what you are putting on the pH paper. So vaginal secretions are more acidic, and amniotic fluid is more alkaline. So if you see a pH of what you have done from a vaginal swab greater than 7.1, then we do know there is rupture membranes if we're not quite sure, because it could be a slight leak of fluid and not a complete rupture membranes. There could just be a slight leak. And so if we're not sure, because remember there's such a risk of infection, and who we're really worried about with infection is that fetus with the immature immune system and protecting them from invading organisms. So if we do see that there is a rupture of membranes of any kind, we're going to have to decide what to do, because once that membrane is ruptured, then we know that that infant, that fetus, is not safe from bacteria and other organisms. So we need to think about how we want to proceed depending on the age of gestation of that fetus. The next test we do is called the Fern test, and we place those on a microscope slide, those just glass slides that you've probably all seen in biology class or some of your prereqs in your labs, and we put it under the microscope. So amniotic fluid is a narrow fern, and then cervical mucus is a broad fern. So you don't have to be able to distinguish these for this class, but just you might get some questions about fern test and what it is. Just know that it's to test if there is amniotic fluid in the vaginal vault. Okay. So let's talk about the onset of labor now. There are some symptoms that we look for that a woman usually notices that we know that she is about to enter into labor. And one of them is that cervical ripening. And this is the effacement or the softening of that cervix, the lower portion of the uterus, and the dilating of it. So cervical ripening is a symptom of labor, that labor is going to start. And this can happen up to a month before. So she'll go in every week in her last 4 weeks, from about 36 weeks on. She'll go in every week to the prenatal clinic, and she will get measured for dilation and effacement. And she could be dilated to a 1 or a 2 for weeks before she goes into labor. And she'll start effacing at the same time. Lightning is where remember in the lab that we talked about station, where that baby's head is descending, where the presenting part is descending. And once they're in line with those ischial spines, they're at station 0. So lightning is where before the fetus starts moving downward into that true pelvis and engaging in there, they are kind of up higher. And the moms know this because they are pushing against her lungs, and they're kicking her in her rib cage, and she can feel all that. And then once lightning occurs, the baby drops and she can breathe better, but there's lots more pressure on her bladder, and she has to urinate more frequently because of lightning. And then you'll see energy level increases. A lot of people refer to this as nesting, and it happens, for months before a woman is giving birth. But the actual energy level increase I'm talking about is there is believed to be an increase in endorphins 24 to 48 hours before a woman goes into true labor. And that's what this energy level that we're talking about is. And then you see these Braxton Hicks contractions, and this will happen for weeks before she is going into true labor, and they're known as not real contractions or practice contractions. What they do is they're uncoordinated, they're not strong, and they can be resolved, like I talked about in earlier lectures. And then Braxton Hicks will turn into true contractions once they become more regulated and they act upon the cervix to dilate and efface the cervix. And then you might see a spontaneous rupture of membranes. Usually this is what's called PROM. So if you see the membranes rupture before she starts contracting, then that is what is known as PROM, premature rupture of membranes. And that is thought to happen 24 hours before true labor hits. And if it happens more than 24 hours, then we suspect chorioamnionitis, where there could be an infection in the amniotic fluid. Okay, let me see if I can pull this up so you can see this. Oh, I can't do it. Oh, so you're just missing the... Okay, I'm back. So you're just missing the title of the slide called False versus True Labor, so you've got to hear it anyway. But really what I want you to pay attention to is the difference between true labor and false labor is that the cervix is changing. So it becomes effaced and dilates. And with false labor, it's usually uneffaced and closed. So you'll see questions on your ATI about true versus false labor, and really just pay attention to the cervix when you see that. And then we want to check the amniotic fluid. I don't know if I can make this a little bit bigger. I can't, but this is amniotic fluid. So we want to check the fluid anytime a woman comes in and there's rupture of membranes, and we're going to make sure that the fluid is watery, clear, straw-colored, and there is not a foul odor. If not, we know there is chorioamnionitis. With green fluid, this is the passing of meconium, or the baby's first stool. It's this tarry-like substance full of dead red blood cells, and that's where you get the green from. And it's caused by a breech presentation, being past that 40-week term pregnancy, and then any kind of stress in utero will cause the baby to poop in utero. And the baby will come out green. You'll see them, they have this green tint to them, and they usually are very foul smelling when they come out and there's been meconium passing. What we're worried about with meconium is, and I'll go over this more when we talk about newborn, is them aspirating the meconium and getting into their lungs, and it can cause severe pneumonia. So a healthy term baby will be hooked up to all sorts of oxygen needs and will be intubated due to that meconium in their lungs. Okay. So we're going to talk about the labor process in a way where we talk about the 5 different P's, or factors, that affect or define the labor and birth process. So the first P that we're going to talk about is passageway. And this is just the birth canal. So we're going to check to see with the hard structures and the soft structures if that is going to make delivery or the birth process not possible, or if it's going to help things or slow down things. So I spoke about this in lab, but there's one last lab group that did not get to go to lab because because of Corona. But this right here is what we need to think about with the passageway, and this is the pelvis. So the pelvic inlet, you can see right here, is a transverse opening, meaning a baby's head is longer from the face to the back of the head, and from ear to ear it's a thinner part. So the baby has to come into the pelvic inlet transverse. So they're looking either to the right or the left of the pelvis of that mom, right? So that's the only way the baby's head will fit in. Well, this right here, we're looking to the pelvic outlet the opposite way. This is the coccyx right here. So this is a woman, let's say we're giving her a vaginal exam. This is the view that we would be seeing. So as you can see, the oval is longitudinal this time. So the baby has to go through lots of movements or turns in order to come in transverse and exit longitudinally. And we'll talk about what those are. Those are the 7 cardinal movements of labor, and I show you in class. I'm just going to talk through it on video, so hopefully it becomes clear. It won't be as clear as me actually showing you, but hopefully it works. So in women's prenatal visits, they're going to measure her pelvic opening because some women have such a flat, like in this platypelloid, pelvic outlet that they will never, the baby's head will be stuck and the babies will never be able to be delivered vaginally. So we're going to do those measurements, and the provider does this on the exam, and they're going to measure the opening to see whether or not a vaginal delivery is going to be successful. So 40% of women, so most women have a gynecoid pelvis, that nice and roomy. You can see how roomy this is, right? From front to back. Anthropoid, you can see, is a different kind. It kind of is more lengthwise instead of widthwise, wider. So that can be a difficult, slow labor process versus android. So a very small population of women have this, but even smaller women have this android, which is the true androgen or male pelvis, but still some women tend to have this. And you can see right here that this is a very shallow opening, and with an android pelvis, they will never be able to be delivered vaginally, and same with the platypelloid pelvis. And women don't have just a straight gynecoid or android pelvis. They kind of have intermediates or kind of a combination of these. But that's why the measurements are so critical during those prenatal exams to see whether or not, and this is only really on her first pregnancy. Once a woman's had a vaginal birth, they know that it's going to be just fine. But they want to do that before going into the labor process, is measure those pelvic outlets. So the next part of the passageway is the soft tissue, and this is the cervix, the pelvic floor muscles, and the vagina. So when the baby goes through the vagina and the pelvic floor muscles, they're going to flex their head until they're released out of the vagina, and then they extend their head. So the cervix effaces, allows for that presenting part to descend into the vaginal vault. And then the pelvic floors actually help the fetus to rotate inside before they have actually been delivered. And then that vagina kind of just expands, allowing for the baby to pass through. Okay, I'm going to actually pause this. We're going to go on to passenger next time because it's a bigger part and I don't want to cut halfway through between. So I'll be back with the next video soon.